Assalamu alaikum. Another history, syncope. It may become as cardiovascular system history. So, as other history, first RIN, rapid introduction and taking permission for taking note, and then Mom, will you please tell me what brought you here? I'm so sorry to hear it. What happened before the event? Will you please describe the event for me? Do you have any video recording? And how after the event what happened? And do you notice any upward rolling or stiffness, any pallor that time? And then the history of the constitutional symptoms: fever, weight loss, activity, sleep. And then Mom, I'm going to ask the symptoms of different parts of his body. Is it okay or not? So in CNS, is there any abnormal movement, any fits, any weakness, any part of the body, any gait problem? In CVS, any blue coloration, any palpitation, any excess sweating, any exercise intolerance? And in metabolic, for hypoglycemia, any pallor, any sweating, any behavior change present or not? And by up to this point, I want to add, during making any history, first we have note of what is our differential diagnosis could be. So the mnemonic I have made for this is CPD, MCPD. MCPD means M for metabolic cause, C for the CNS cause, P for the psychological cause, and D for the drugs. So M for the metabolic cause: hypoglycemia, electrolyte imbalance, anorexia nervosa. And CNS cause, if there is any tumor, any epilepsy, migraine, and reflex anoxic seizure. And in for CPD, and the psychological cause, CP, P for the psychological cause: history of panic attack, vagovagal shock, orthostatic, postural hypotension, postural tachycardia, orthostatic tachycardia. And drugs is tricyclic antidepressant, captopril, insulin, sedative drugs. So the history we have completed up to the systemic inquiry. And then he has any long extending illness? What did you do so far? Did he need any kind of hospitalization, and any medication, any surgery, any important perinatal history, growth and appetite? And do you have any concern regarding school performance, and vaccination history, allergy history? And Mom, now I'm going to ask you about your family. Would you please describe your family? What do you do for your living? It is satisfactory when you are not at home. Who take care of the child? And any death due to sudden cardiac death, less than 40 years of age, school performance, friends, any bullying present or not? And does the school nurse know about this condition? Home environment, what is your biggest worry, what is your expectation for us? And I wish her speedy recovery. Today I took history from the child. She is a 15 years old girl, referred from GP because of repeated syncope for last 1 year and mostly last 3 days, which is triggered by panic attack lasting for few minutes, but there is no history of palpitation or exercise intolerance. Family history of cardiac even less than 40 years is present. They are socially solvent and with good school performance. And then what's your management plan? Airway, breathing, circulation, vital sign, cardiovascular system examination. And regarding the management of it may be a vasovagal. If in case of vasovagal or simple or neutrally mediated syncope, it occurs age group 10 to 16 years, and circumstances and activity before the syncope: prolonged extending and hot humid environment, crowded place, shortly after rising in morning, sight of blood, pain, fear, anxiety, dehydration, being unwell, prodromal symptoms, dizziness, nausea, blurring vision, headache. And what is orthostatic hypotension? It occurs 10 to 16 years, and definition is drop is systemic blood pressure more than 20 millimeter and or diastolic more than 10 millimeter or mercury within 3 minutes of upright position without moving. And circumstances and activity before the syncope: prolonged bed rest, dehydration, drug, diuretics, antihypertensive, vasodilator. Prodromal symptoms: light headaches, dizziness, blurring of vision. Postural orthostatic tachycardia syndrome. Age group usually teenage girl. Definition: increase of heart rate more than 30 beats per minute within 10 minutes of standing. And prodromal symptoms: dizziness, light headaches, nausea. Other symptoms: exercise intolerance, chronic fatigue syndrome. And the management for the vasovagal or orthostatic intolerance group with normal examination, normal 12-lead ECG, reassurance, and lifestyle modification, such as avoid dehydration, avoid extreme heat, increase salt intake and fluid intake in diet. If there is red flag for cardiac disease and abnormal CVS examination or abnormal ECG, so discuss with local pediatric with expert in cardiologist or a special cardiology team. All patients have to be seen in pediatric cardiology OPD. Thank you. Assalamu alaikum.